In South Dakota, there are 9 positive cases and 6 tests pending. So far, there have been 327 negative cases, and information about the coronavirus and recommendations from the CDC are changing so rapidly. Dr. Wendell Hoffman joining me this morning with Sanford Health to talk more about, give us an update, because you were here just a couple weeks ago and things have changed so much in that amount of time. And as I was mentioning, they're changing literally by the hour. The CDC recommending last night no events over 50 people. Like, we're talking weddings getting canceled or postponed now. These are very big measures. So what is the point of these recommendations and these cities taking these measures?
So thank you very much for having me in, and this is a very kind of uncertain, unnerving time for the population. The reason for all of these changes is what we have seen in, first of all, in China, and then in Europe, and specifically in Italy and Iran, where we're seeing healthcare facilities becoming overrun with patients who are sick with COVID. If you think about it, if we do nothing, then the data and modeling suggests that over a short period of time, about 60% of the population could become infected. That's a lot of people. Yeah, you do the calculations in South Dakota, 800,000 people, and you begin to see what happens. Plus, the doubling time of this virus is somewhere between 5 and 6 days. So just do the math. If we do nothing, now that's if we do nothing. Now, we know then from what other countries, specifically what China and South Korea have done, that we can actually make a huge difference here. We can what we call flattening the curve. That means that there may be over time the same number of patients involved, because we think this virus is kind of probably here to stay, and it may continue to disseminate throughout the population. But we flatten the curve. We delay how many people at one time are involved, and so we extend it out so that we don't overrun our healthcare facilities. Because if we do that, then that would truly be a catastrophe.
CDC overnight recommending that large gatherings of more than 50 people, they suggest not doing that. That would include a bunch of different events all over the country, and it's all in hopes to help mitigate the spread of the coronavirus. We're joined by Dr. Wendell Hoffman with Sanford Health to talk more about the why we're doing this and why they're making these drastic recommendations. Because when you talk about gatherings of over 50 people, that includes so many things like weddings, family reunions, things like that they're going to have to get postponed.
Yeah, so it is said that people who know the what and the why or the what and the how will always follow those who know the why. Leadership is about the why, and so that is really true. In this situation, the why is that we have a vulnerable population that needs to be protected. If you think about it, every time we get a vaccine, we can protect ourselves from whatever we're vaccinating for. However, there's no immunity out there against this virus in the broad population. Therefore, the communities must become the immune system. We must protect the most vulnerable until a vaccine becomes available. And that's the why a 20-year-old, otherwise healthy individual has to buy into this, because they can help protect, through their own social distancing, the spread of a virus that could eventually wind up in a person who's at increased risk for serious complications.
And you talk social distancing. I want to go over this real quick about what does that mean? Does that mean that I have to stay at home for the next couple weeks? Does that mean I can't go to the grocery store or I can't go out to dinner?
So right now the CDC is recommending groups of 50 or more to consider anyway. I mean, we are sort of a free nation. We're not under martial law, and so we still have a decision in this matter until we would go to more stringent precautions. But those kinds of things that you've mentioned, no. I mean, people can still go to the grocery stores. People can go to essential locations where they need to conduct their business. You're going to see a whole varying group of ways in which we conduct social distancing. But the bottom line rationale is that the more I can distance myself from that person who is at risk, the better.
Okay, and we're going to go over some fact versus fiction statements. A lot of things kind of floating around social media, people in conversation. I've heard some crazy things myself. So we'll go over a statement and you'll tell us whether it's fact or fiction. Drinking water will help you not get the virus. If the virus gets into your mouth, the water will wash it to your stomach where the acid will kill the virus.
Well, it's fiction. I mean, this virus has not been shown to be passed through food or water. So that is really fiction, and we can be confident in our food supply, and so that was fiction.
A person who has COVID-19 could have it and then not show symptoms for 14 days.
So that is actually fact. The outer limits of the incubation period is about 2 weeks. The average incubation period is around 5 or so days, maybe 5.5, 6 days. And so that is true. It could be out to as long as 14 days for somebody to actually come down with symptoms.
And our last one, warm weather will eliminate the virus.
It's a great question. We don't know. We know that other flu-type cold viruses are affected by the humidity, by the temperature, and as we move into the spring, these organisms kind of tend to melt away, and coming back then again when the weather changes. We don't know if that's exactly the case for this unique novel virus, but we suspect that it will be. So that is more fact than fiction.
All right. Dr. Hoffman, thank you so much for coming in. We appreciate it.
Thanks for having me.
Hey everyone, Kelsey Passold here. Thanks for checking out the Dakota News Now YouTube channel. Watch more featured stories, interviews, and show highlights over here. And make sure to follow along for more by hitting the subscribe button below. Thanks for watching.